Exparel liposomal is a local anaesthetic that is used in adults to treat pain after certain operations. It can be used either for local pain relief by injecting it around the edges of small to medium-sized surgical wounds, or for regional pain relief by injecting it around the nerves that supply the lower limbs or the shoulder. It contains the active substance bupivacaine. How to use. Exparel is given as an injection placed into an area near your surgical incision. You will receive this injection in a hospital or surgical setting. Exparel can have long-lasting or delayed effects. After at least 4 days, 96 hours after your surgery, tell a doctor or dentist who treats you that you recently received an Exparel injection. Call a doctor if you have joint pain or stiffness or weakness in any part of your body that occurs after your surgery, even months later. Usual adult dose for pain. Local analgesia via infiltration. Dose will be dependent on size of surgical site, volume required to cover area and individual patient factors that may impact the safety of an ambient local anesthetic. Maximum infiltration dose 266 mg 20 ml. Regional analgesia via interscalene brachial plexus nerve block. Based upon study of patients undergoing total shoulder arthroplasty or rotator cuff repair, 153 mg 10 ml. Maximum dose for interscalene brachial plexus nerve block 153 mg 10 ml. Who should not take Exparel? The following conditions are contraindicated with this drug. Check with your physician if you have any of the following: methemoglobinemia, a type of blood disorder, second-degree atrioventricular heart block, slow heartbeat, significantly low blood pressure, severe liver disease, a condition where the body is unable to maintain adequate blood flow called shock, anemia from pyruvate kinase, regional anesthesia for labor pain, an abnormal but slight slowing of the heart called first-degree atrioventricular block, kidney disease with likely reduction in kidney function. Warnings. You may still feel numb or be able to move the numb area for up to 5 days after you are treated with Exparel. Before receiving Exparel, tell a doctor if you have liver disease, heart disease, a heart rhythm disorder, or a history of seizures. Tell a doctor if you have ever had an allergic reaction to any type of numbing medicine. Exparel side effects. Get emergency medical help if you have signs of an allergic reaction to Exparel: hives, red rash, itching, sneezing, difficulty breathing, severe dizziness, vomiting, swelling of your face, lips, tongue, or throat. You will be watched closely after receiving Exparel to make sure you do not have a reaction to the medicine. Tell your caregivers at once if you have any of these signs of serious side effects: ringing in your ears, drowsiness, feeling restless or anxious, feeling like you might pass out, speech or vision problems, a metallic taste in your mouth, numbness or tingling around your mouth, fast or slow heart rate, feeling short of breath, feeling unusually hot or cold, tremors, twitching, mood changes, ongoing numbness, weakness or loss of movements where the medicine was injected, joint pain or stiffness or weakness in any part of your body for months after your surgery.